In Unani medicine, the common cold is defined as an acute condition caused by the predominance of cold and moist qualities in the body, primarily affecting the upper respiratory tract. It is believed to result from an excess of phlegm, known as Balgham, one of the four humours: blood, phlegm, yellow bile, and black bile. This imbalance can be due to external influences like cold air or internal factors such as a weakened natural healing power, also called tabiat. The condition is seen as the body's attempt to expel this excess phlegm through the nasal passages and throat. The signs and symptoms of the common cold in Unani medicine are observed holistically, considering the patient's temperament and the state of their humours. Common manifestations include nasal discharge, which can be watery or thick mucus, leading to a runny or blocked nose due to excess phlegm. Sneezing is a reflex to expel irritants or excess moisture from the nasal passages. A sore throat may occur due to irritation or inflammation caused by phlegm dripping down the throat. Coughing, either dry or productive, results from phlegm accumulation in the respiratory tract. Headaches often arise due to congestion or pressure from excess moisture in the head. Malaise or fatigue is a general feeling of weakness as the body works to restore balance. Occasionally, a low-grade fever may be present if the temperature shifts slightly toward heat to combat the coldness. These symptoms may vary depending on the individual's temperament. For example, cold and moist individuals may experience more severe symptoms. In Unani medicine, diagnosis is primarily clinical and relies on the physician's observation and examination rather than modern laboratory tests. Key investigative methods include pulse examination, known as NABS, where the physician assesses the pulse to determine the state of the humours and the body's temperament. Urine analysis, or BAL, involves examining the color, consistency, and odor of urine to identify humoral imbalances, such as an excess of phlegm. Stool examination, referred to as baraz, helps assess digestion and the presence of waste products linked to the condition. The practitioner also takes a detailed patient history, noting environmental exposure such as cold weather, dietary habits, and lifestyle factors, while observing physical signs like tongue coating, posture, and voice changes. Treatment in Unani medicine focuses on restoring the humoral balance by counteracting the cold and moist qualities of the common cold with warmth and dryness. It is tailored to the individual's temperament and the severity of the condition. The main approaches include dietotherapy. Consume warm, light, and easily digestible foods such as barley soup, porridge, or herbal teas. Avoid cold, raw, or heavy foods that increase phlegm, such as milk, yogurt, or fried items. Include spices like ginger, cinnamon, and black pepper to warm the body and reduce moisture. Pharmacotherapy. Single drugs. Herbs with hot and dry temperaments are used, such as ginger, which warms the body and relieves congestion, black pepper, which expels phlegm and clears airways, and hyssop, which reduces nasal discharge and cough. Compound formulations. Common Unani medicines include a decoction of herbs like licorice, cinnamon, and fennel to relieve symptoms, a syrup to soothe the throat and reduce phlegm, and which strengthens the body's vitality during recovery. Regimental therapy. Steam inhalation. Inhaling steam with herbs like eucalyptus or mint to clear nasal passages. Massage. Applying warm oils, such as mustard oil, to the chest and back to promote warmth and circulation. Cupping. Occasionally used to remove excess phlegm from specific areas, with dry cupping being preferred. Warm baths. To stimulate the body's heat and expel coldness. Lifestyle adjustments. Rest in a warm, well-ventilated room to support recovery. Avoid exposure to cold winds or damp environments during treatment. The goal is to strengthen the body's natural healing power, while eliminating excess phlegm and restoring the temperament to its balanced state. This article is intended for educational purposes only, to provide insight into how the Unani system of medicine approaches the common cold. It is not a substitute for professional medical advice, diagnosis, or treatment. If you are currently undergoing any treatment or experiencing symptoms, please consult a qualified Unani practitioner or healthcare expert for guidance tailored to your specific condition. This explanation reflects the principles of Unani medicine as derived from its traditional framework, emphasizing a holistic and individualized approach to health and healing.